this is Moor Cottage Veterinary Hospital. We're in Bracknell. We have between 4 and 6 vets working full time, and slightly over that nurses, somewhere between 7 and 9, but obviously different people are here in different days. We are quite fortunate in that we've got 2 buildings on the premises. We've got the main hospital where all of the dogs are seen, and then we've got a separate cat clinic where we see all of the cats and do the majority of the feline procedures. On any given day, we'll have somewhere between 20 and 30 cat appointments in our cat clinic, and probably a similar number, maybe a wee bit more of that in dogs in our other clinic. In the cat clinic, we're quite lucky because we can see cats over here well away from all the dogs and all the noise and all the excitement that sometimes happens in the main clinic. And when we set it up, we were quite keen to make sure it was ISFM accredited up to the gold standard, just so we could make sure that everything was done just as well as we could be doing it. We always try to measure blood pressures on any cat that's diagnosed with CKD or with hyperthyroidism. In practice, it might not happen in every single case, but that's always the goal. Outside of those sort of pathologies, we try and offer and are quite keen that cats come in for regular health checks. That would include blood pressure monitoring when they're a bit older. We call them our golden oldies clinics, and we start running them from 10 years of age. If you're wanting to try and measure blood pressures more regularly, it's really helpful to have a nurse that's good at it. Have a nurse that you know that will get it quickly and efficiently, and in general they tend to be better than me at doing it. We're also quite fortunate in that we measure a lot of routine blood pressures throughout our patients' anaesthetics, and that means that most of the people that are doing those anaesthetics get very quick and very efficient and are just good at it. When we want to measure blood pressures in a consultation setting, there's a couple of different ways that we might do that, and it's individual to any cat and any owner. Some cats respond better and are more calm with the owners around. Some are better if you take them away somewhere into the prep room where it can be kept calm and dark and quiet, and they respond better that way. Some are better with just the vet and the nurse, or some are better with just the vet and the owner, and so it's quite individual. We'll always get a better or more accurate blood pressure in the calm cat, and that usually starts with them walking in the door. So we make sure that any areas where the cats are coming to is kept as calm and quiet and as relaxed as possible. There's nice gentle music playing. There's fairly way plug-ins in most of the sockets in the building. We use blankets to cover over the cat carriers when they're on a elevated area within the waiting room. The blankets are impregnated with the pheromones as well. When we bring them into the consultation room, we're quite careful to be handling them appropriately. So we're not pulling them out of baskets. We're opening the basket and letting them wander out. We're letting them explore the clinic. When that means that when we eventually do come to run the blood pressure, they've had a wee bit of time to acclimatise, and if they do get a wee bit upset with it, stop, leave them to relax, and then come back to them a certain amount of time later. We use Doppler to take blood pressures here. The whole procedure itself will take 3 to 5 minutes, something like that, in order to get a few readings that we can then take an average of. If a vet wasn't routinely measuring blood pressures, I would be concerned that they might be missing some fairly important clinical information that might be quite valuable for the health of the patient. Given that it's actually quite a straightforward thing to be doing, I would say there's no good reason not to, and it will improve the outcomes and the quality of life of some very common feline diseases. If a vet's concerned about getting accurate measurements from blood pressures, I suppose the most useful thing would be just practice. Once you're doing them regularly and consistently and get used to the equipment and you can do things quickly and efficiently, then you can be first of all more confident in the results that you do get, but you're able to get the blood pressure quicker and more efficiently, and you will get more accurate readings because you can keep the patient calm throughout the measurement process. When we start talking to owners about measuring blood pressures, they immediately relate to that and think, oh yes, of course, that's quite a normal thing. When I was at the doctor's, the first thing they did was check my blood pressure. It's almost an expected thing from some owners. When owners come back in and their patients have been successfully treated for hypertension, the blood pressure is managed and it's appropriate, it's quite common for them to say, oh, Fluffy's doing lots better, often not having ever realised there was any sort of major issues previously. There will just be a recognition that they're happier, they're more playful, they're more back to maybe how they were when they were a wee bit younger. And in some cases, owners will have mistook the symptoms of hypertension for just them getting older and just them slowing down, and it's quite nice to see when they improve and they go back to being happier and playful and just more themselves.